Let's talk about dark under eye circles and what to do about them. So, I get a question about this a lot when people complain of dark circles under their eyes and what can I do? So, the first thing you need to determine is what's causing them. And there's basically three that I can think of off the top of my head for reasons why people get these dark circles. Number one is hereditary. So those are just due to melanin in the skin pigmentation that starts as early as childhood. You see it in multiple family members. You can tell that it's genetic. It's just something that someone's born with a propensity to have starting from when they're very little. And those are probably the hardest ones to treat. The most important thing for those people is going to be using sunscreen every day because any sun exposure can make that pigment darker. And then, of course, they can use under eye concealers and things like that to help camouflage those dark circles. But they're a little bit hard to treat. There are some skincare ingredients that help fade pigment in the skin. So things like vitamin C, which of course you don't want to get too close to your eyeball, kojic acid, licorice root, tranexamic acid, and alpha arbutin are all ingredients in skincare products that can help fade pigmentation. So that's worth trying and being consistent with for a good 6 months before giving up to see if it helps. Now, number two, dark circles under the eyes are notoriously seen in people with uncontrolled seasonal allergies. So if you're somebody who has bad seasonal allergies, hay fever, and say, for example, all spring, you're just a mess with, itchy eyes, runny nose, postnasal drip, sneezing, etc. If you're not treating the seasonal allergies with anything at all, you very likely could wake up with dark circles under your eyes because that's what we call the allergic shiners. So the best way to treat that is actually to treat the seasonal allergies rather aggressively and regularly. If you just take a Zyrtec every now and then for symptoms and you're not actually on it every day, it's not really going to help too much with your under eye area. You kind of need to be on the Zyrtec at least for the season of whatever you're allergic to. It might be all spring, it might be all fall, but it's going to help you with this concern if it's due to allergies. The last one is dark under eye circles may not actually be due to pigmentation. They may just be due to volume loss. It naturally happens to us as we age. So there's a shadow under the eye, like in photographs or whenever there's lighting that's coming directly overhead, like in an elevator. This can be addressed with dermal filler. You just want to be very picky about who does it to make sure they're properly trained to restore that volume loss.